little scary, isn't it? This is a skull, and it's a close-up view. And what we're going to do right now in this video is go through a number of close-up views of the skeletal system and have a look at a little bit more detail at some of these bones that you need to know. So we're starting with the skull, and we're starting with the frontal bone. The frontal bone is that most anterior bone in your forehead, and you can see very prominent there. And it is that foremost, most anterior part of the skull. We can sort of see the periacial bone here at the side. Remember, that's the two halves. Your periacial bones have a suture down the middle, and it's their sagittal suture, and you're going to have the periacial bone on each side of the skull in the most superior part. We also have seen the temporal bone. The temporal bone is on either side as well. The temporal bones are going to be just a little bit superior to your ears and have that feature just covering the brain on either side and a little bit more inferior to your periacial bone. Talking about a new bone here, this is your nasal bone. So your nose has majority cartilage. You can move it around fairly easily. But at the very top of your nose, you do have two bones, and they do stick out. There's a little suture down the middle, if you can see that there. But it has, your nasal bone is kind of protecting that olfactory part of your nose, and it has a very easy kind of breaking status because they're fairly thin, and you've probably heard or know of people that have broken their nose, and that's what they break is the nasal bone. So that's the nasal bone. Very easy to palpate right at the bridge of your nose. It's where you hold your glasses. The zygomatic bone is that cheekbone we mentioned. It is very prominent here on the lateral side of your skull. You can see the sutures pretty clearly here, where it starts and where it finishes. So just here above the maxilla, beside the maxilla, and then just inferior to your frontal bone. And it makes up part of your eye socket as well. So part of your frontal bone and part of your maxilla and part of your zygomatic are going to make up the eye socket around your eye. More inferior, we have your maxilla. That top of the top row of teeth are going to be into the maxilla. And just note where it starts and where it begins, especially with the zygomatic. Sometimes people get confused, and you just definitely need to look at the sutures on where it begins. And it goes actually all the way up and articulates here with the frontal bone and with your nasal bone as well. So quite an interesting irregular bone there. And it's fixed. It's not going to move around. And it's part of your jaw system, but not the movable part. The movable part is this part, the mandible, and it's that jawbone right here, and the bottom row of teeth will be in the mandible. Here's another view of the skull, and very easily we see the frontal bone, see the periacial bone very clearly. We also see the temporal bone here very clearly, noting where the sutures are. You have a small bone here, which you don't need to know. It's called your sphenoid, but you don't need to know that one. At the more posterior part of your skull, you have the occipital bone. And so that shows up very clearly here. And it's going to articulate with your temporal and your periacial bone. That's that base of the skull. And you have that neutral line that it's a bit of like a notch there in the very back of your skull. So that's your occipital bone there at the base. So when I'm thinking about my skull, I think frontal, periacial, occipital, I think temporal at the side. All right. So frontal, periacial, occipital, temporal, and then you've got the zygomatic, nasal, maxilla, mandible. Good. This is the spinal column, and we looked at this, but again, a quick review. So we have three different regions of the spinal column. We have the cervical first. The cervical vertebra are the components of your neck, and we number the cervical vertebra starting superior to inferior 1 to 7. So this is cervical vertebra number 1, number 2, number 3, number 4, number 5, number 6, and number 7. Note number 7 is quite prominent. The spine, what we call the spinous process of your vertebra, is quite prominent, and you can really palpate that at the base of your neck, at the more inferior part of your neck. And we also talked about C1 and C2. So C1 and C2 have special names. C1 is your atlas. That is where your skull rests. Again, that Greek legend of Atlas carrying the world on his shoulders, the entire skull resting on the atlas there. And you're going to have your flexion and extension of the neck at the atlas. The axis is C2. C2 is your axis, and C1 and C2 rotate. That's where you're going to have rotation at the neck, is at C1 and C2. They rotate over each other, so called the axis, right? So just those two have special names, and so you need to know them. But all of your vertebrae have special names because we say the first letter of the region, C, and then the number, right? So this is C4 right here, and that's how you need to label all of your vertebrae. Next, we have the thoracic region, slightly larger. You can note that this is like a sagittal view of your spinal column, so you can get all of these numbers here, but you also see the curve of your spine in this view, right? And the thoracic is really that curving part of your spine. So it's T1, thoracic vertebrae number 1 is here. So we don't go kind of 1 and all the way down. Now it's a new region, the thoracic region, and we start with the letter T. So this is T1, this is T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12. And we remember that our ribs are articulating, our 12 ribs are articulating to our 12 thoracic vertebrae. So that might help you remember. We have 12 ribs, we've got 12 thoracic vertebrae. There's a line here noting the intervertebral disc. This is not a bone. This is a piece of cartilage that's going to separate the vertebra from each other and provide that cushioning and the ability for it to flex around, because it's a very flexible part of our body, because we need that flexibility to be able to bend and twist and rotate. So this joint here has that cartilage. So between each of the individual vertebra, you have this intervertebral disc that gives it that really great ability to flex. One individual vertebra is not going to allow much movement, but when you combine all of the different vertebrae, you can see how much movement you can have. Anyways, T1 to T12. This is the lumbar region. So the lowest 5, the most inferior 5 vertebra are the lumbar region. Very big, large, thick vertebra. So this is L1, lumbar vertebra number 2, L3, L4, and L5. So really large and able to absorb a lot of impact. So the lumbar region. The more inferior part of your spinal column are 2 more larger and standalone bones. One is your sacrum, and the sacrum is going to have 4 holes on the left and right sides to allow nerves to go through, to allow nervous interaction with the lower body. And then your coccyx is what we call your tailbone. It's that furthest, most inferior part of your spine. That is actually the tailbone, and the part you're sitting on right now is your coccyx. So just make note of that. It is part of the spinal column. The rib cage is next, and we're looking at the entire rib cage here, different sections. So we've got your entire sternum or sternal body. Okay, right here, the entire sternum is a one part. We can call it the sternum, but it is actually broken down into three pieces. And starting at the more superior part here, we got the manubrium. Um, right here, a little bit more inferior, is your sternal body itself. And then more inferior, we have your xiphoid process. Okay, so those three parts together make up the sternum. And I'll always be clear on, what I'm looking for with this sternum, whether I'm looking at the very top, the manubrium, the very bottom, the xiphoid process, or the sternum itself, the sternal body itself. The ribs, of course, are numbered 1 to 12, and we looked at that earlier. Rib number 1, rib number 2, rib number 3, rib number 4, rib number 5, rib number 6, rib number 7, rib number 8, rib number 9, rib number 10, rib number 11, and rib number 12. We don't classify them according to region. We just go 1 to 12. Okay, so that's important to note. But you do have sort of like regions with your ribs. You have 7 true ribs. True ribs have a direct articulation to the sternum. All right, so this rib right here, number 7, has direct articulation. 6, 5, 4, 2, and 1. We have 3 false ribs. So 8, 9, and 10 are false ribs. They kind of have an indirect articulation to the sternum. And even number 10 here, when we do look at it internally, it does have kind of this indirect articulation, has a little bit of costal cartilage here. And so it has that indirect articulation. It's not going to articulate directly right to the sternum. It's going to articulate to the one above. 11 and 12 have the distinction of being floating ribs. They're called floating ribs because they have no articulation to the sternum at all. So you can see 11 here and 12, they just have no costal cartilage and no ability to articulate to the rib above them. So that's the rib cage. On the anterior side and the posterior side, we see all your thoracic vertebra here, and just noting that the ribs are articulating to the thoracic vertebra. We've got your scapula, and it is that bone that's posterior, and you can feel this spinous process. You can palpate it really easily on the back here, and the clavicle is here as well, making up that portion of your thoracic cavity, your rib cage. And really what those are going to do is they're going to allow you to move at the shoulder, whether you're circumducting or elevating or depressing or extending or flexing. The scapula is going to be involved in that movement, moving around the back, and the clavicle is going to be moving. And they're really supports for the different muscles. They're going to be connecting points for the different muscles that are going to allow you to move there at the shoulder. Really protective thing. The rib cage obviously is covering very vital organs, your heart, your lungs, and your diaphragm, and different parts that are important for life. And you can see how well designed it is, right? It's got that super protective covering, but also allows for a lot of flexibility, allows for that breathing with the costal cartilage. You have all kinds of important things that your rib cage is protecting, and a lot of important ways for it to move, and it does that really, really well. And then last here in this video, at least, we're going to look at the pelvis. The pelvis is another super important protector of course, our reproductive systems and a lot of our digestive and urinary systems. So this is the pelvis itself. Now, you'll note here, I think it's cut off a bit, but on your diagram, it says os coxae, and that's kind of the formal Latin name for the entire pelvic bone itself. you can use that and impress us all with your Latin, but you can just call this the pelvis. The entire thing, I'll take the pelvis as well as os coxe. But hey, use your Latin. You don't get to use it very much. You have three major parts of the pelvis. Okay, I think the part we've already talked about is the ilium, and this is that wide, most kind of lateral part of your pelvis. It's the part that we think, oh, my hips are I got wide hips, and that's your ilium. Sorry to say, but it's got that really wide look to it, and the ilium is a very prominent feature of the pelvis. So ilium on either side of the pelvis there. A little bit more anterior and inferior is your pubis. All right, your pubis. Now, you thinking, sir, like there's just kind of dotted lines there. These are not actually these are not actual sutures in you in your pelvis. And why do we have these different bones? Well, when you were developing, these were kind of separate bones, and they fused together. And we do delineate between these different, even though they have now fused together. So for anatomy purposes, we do differentiate them. So your pubis is more inferior and anterior to your ilium, okay? And your pubis is going to be a part that's going to be important for protecting a lot of those vital organs that we talked about earlier, your reproductive, digestive, urinary system. Another thing with the pubis is that it has a pubis symphysis, all right, or symphysis pubis. And that's a piece of cartilage that is the connecting point between the two pubis bones. The ilium and the pubis, they will expand, especially when a woman is pregnant at childbirth. And this is the line that will kind of expand, and it will relax your body. A woman's body will relax that connecting point right here at your pubis symphysis, and will allow for a little bit of kind of movement there to be able to have the child. So also interesting to note, the pubis and the ilium make up this large space, this large foramen here in the pelvis, and it's different for males and females. The females have a slightly larger space or foramen here, and males have a slightly smaller. And also, females have a slightly more tilted, more lateral ilium, and males tend to have a little bit more medial ilium as well. So little differences there. So ilium, pubis, and then we have the ischium. Okay. So the ischium is the more posterior part. So you can see a little bit inferior to your pubis, but it's mostly the posterior part of your pelvis. And the ischium and the pubis are going to make this large, what we call an acetabulum. The acetabulum of your pelvis is a major, major landmark where the femur, the head of your femur, is going to fit in that acetabulum. So the ischium is that part that is going to be the more posterior part, combining with your pubis to make that acetabulum. Right? So we've got ilium, more superior. That big wide part is your ilium. The pubis is more anterior, inferior, anterior, and the ischium is inferior, posterior part of your pelvis itself. And we're noting the sacrum is here on the diagram. Last thing is just a landmark that you need to know, and that's your iliac crest, or crest of ilium. So right at the very superior part of your ilium, you have your iliac crest. And it's pretty easy to feel if you dig your hands into your sides. I'll try to show you here a bit, but dig your hands into your sides and press down on the top, and you are feeling your iliac crest. Okay, so that part between, press into that, your obliques there, between your 12th rib, and then you're going to feel the next bone is your iliac crest. Okay, that's not a bone, it's a landmark. So that major landmark is your iliac crest. Okay, and that's the major landmark on your ilium. All right, hope that was helpful. And we're going to be looking at some other diagrams soon, I hope. Thanks.